Now, let me digress and tell you a little story about how I got to be talking about this and why I'm spending my time with this presentation today. I have spent 35 years with patients treating temporomandibular joint problems. For the first 30 years of that experience, I limited my treatment primarily to surgical interventions. And after 30 years, I just got tired of people coming in 6 months, a year, 2 years after temporomandibular joint surgery and saying, Dr. Urbanek, it felt good for a while, but it's starting to hurt again. I got tired of that. And so I decided to do something that I thought was quite unique in the medical field. I was going to sit down and I was going to listen to my patients talk about their problem. I had already read all the textbooks, or at least most of them. There are journals associated with temporomandibular joint problems. I had copies of those and I read those. I went to many lectures over the years and I did pretty much what the profession said you're supposed to do when you had temporomandibular joint problems. But incessantly, continuously, patients would come back and they would tell me, Dr. Urbanek, thank you very much. It felt good for a while, but it's starting to hurt again. So as I said, I decided to do something unique. The next patient that came in to see me, I sat him in front of me and I said, Mrs. Jones, I'm going to sit here with you and I want you to tell me all about your problem. I want you to tell me when it hurts, what you think about it when it hurts, why do you think it hurts, why your husband think it hurts, does the dog bark when it hurts, what phase of the moon is it when it hurts. I want to know everything that you can tell me about it. And the first patient, I remember I listened to her for about 45 minutes. And she told me some things that I had heard before, and she told me some things that I thought were very interesting, but she told me something I had never heard before. And then the next patient I interviewed, same thing. I sat there for quite a while listening to the second patient, and I heard a lot of things I had heard before. And the third patient, a lot of things I had heard before. But after about 6 or 8 patients, I kept hearing something that I had never heard before. And it struck me as very unique, and this is what they said. Dr. Urbanek, if I take a pencil eraser and gently put it between my 2 front teeth and bite down gently, it feels better. Or if I take my finger and gently put it between my 2 front teeth and gently bite down, it feels better. Or a couple of the ladies said, if I take my tongue and gently put it between my 2 front teeth, it feels better. And the light went off. I had the big aha moment. I went, I bet if I make something that goes in between the 2 front teeth, it will feel better. And so I went to my lab, and for the first woman, I made her a little device that went in between the 2 front teeth, and I gave it to her, and I said, I want you to come back in 3 weeks and tell me how you feel. And she came back in 3 weeks. I walked in the room, and I said, Mrs. Jones, how you doing? And she said, thanks, Dr. Urbanek, all my pain is gone. Now, this is a woman who had had pain, all of those symptoms, for 30 years. And I couldn't believe it. I thought she was joking. And when she discovered that I thought she was joking, she got a little indignant. She said, no, my pain is gone, and I really appreciate it. So the next woman that had the problem that came in my office gave me the history. I made her a little device, and I gave it to her, and I said, put this in your mouth, come back in 3 weeks and tell me how you're doing. She came back and said 95% of her pain is gone. The third woman I did it for, she came back and said 90% of her pain was gone. And the fourth woman came back and she said 100% of my pain is gone. And I knew there was something very unique going on here. I knew that it worked, but I didn't know how it worked. And that's where I had to do a little investigation as to determining how this device actually worked. So I used a lot of the other information I had gleaned over my professional career, both in dental school and medical school and surgical training and my research training with my independent research projects with the National Institute of Health and things like that. And the first thing I came to grips with is that there is a common denominator. There is a common denominator with all patients with temporomandibular joint disease. After doing several thousand, I've probably done 2,000 temporomandibular joint surgeries, whether they be open joint surgeries, where you actually see the joint visually with the eyes, or through a scope, which we call closed joint surgeries. There was one thing that I always noted during those surgeries, and that is that there was inflammation in the joint. And that actually is the common denominator with joint problems. The real cause of temporomandibular joint disease is inflammation.